Let us start this lecture with carpal tunnel. The topics that will be covered under carpal tunnel is its introduction, location, formation, relation and its applied anatomy. Now let us move on to the carpal tunnel. It is a strong fibrous band that bridges the anterior cavity of the carpus, also called as the carpal arc, and converts into a osseofibrous tunnel called the carpal tunnel. The flexor retinaculum is triangular and is formed due to the thickening of the deep fascia in the front of the carpal bones. Let us move on to its attachments. Medially is attached to the pisiform and the hook of the hamate, and laterally it is attached to the tubercle of the scaphoid and the crest of the trapezium. On either side, the flexor retinaculum gives a slip. A superficial slip on the medial side called the olar carpal ligament, which is attached to the pisiform bone, and a deep slip on the lateral side is attached to the medial lip of the groove of the trapezium, which is shown in the before diagram, which converting it into a osseofibrous tunnel for the passage of the tendon of the flexor carpi radialis. Now let us move on to its relation, which is structure passing from the superficial to the flexor retinaculum, from the medial to the lateral side. These are the ulnar nerve, ulnar artery, palmar cutaneous branch of the ulnar nerve, tendon of the palmaris longus, palmar cutaneous branch of the medial nerve, and the superficial palmar branch of the radial artery. Let us see the structures which passes from the deep to the flexor retinaculum. These are the tendons of the flexor digitorum superficialis, the tendons of the flexor digitorum profundus, and the tendons of the flexor pollicis longus and the median nerve. Now, I'll be summarizing the most important points to be remembered under carpal tunnel. Let us start with its introduction. It is a strong fibrous band that bridges the anterior concavity of carpus, also called as the carpal arc, and converts into an osseofibrous tunnel called the carpal tunnel. The flexor retinaculum is rectangular and is formed due to the thickening of the deep fascia in the carpal bones. Let us move on to its attachments. Medially, it is attached to the pisiform and the hook of the hamate, and laterally, it is attached to the tubercle of the scaphoid and the crest of the trapezium. Now let us move on to its relation. From the medial to the lateral, let us discuss about the structures passing superficial to the flexor retinaculum. Those are ulnar nerve, ulnar artery, palmar cutaneous branch of the ulnar nerve, tendon of the palmaris longus, palmar cutaneous branch of the median nerve, and the superficial palmar branch of the radial artery. Now let us move on to the structures passing deep to the flexor retinaculum, that is through the carpal tunnel. Those are tendons of flexor digitorum superficialis, tendons of flexor digitorum profundus, and tendons of flexor pollicis longus and the median nerve. Let us move on to the last section of the short answer, which is the carpal tunnel syndrome. Compression of the median nerve in the carpal tunnel gives rise to loss of sensations and the weakness of the muscles of the thenar eminence. Let us move on to its etiology. Etiology basically means the scientific study for the cause of the disease. Let us move on to the causes due to the involvement of the bones, which is arthritis, dislocation of the lunate, or fracture of the Lillis joint. Let us move on to the soft tissue pathology, which involves tenosynovitis. What does tenosynovitis exactly mean? It is an inflammation of the fluid filled sheet, which is also called as the synovium, that surrounds the tendon, typically leading to the joint pain, swelling, or stiffness. The next one is the acromegaly. Acromegaly is basically a disorder that results from the excess growth hormone after the growth plates have been closed. And last one is the toxemia of pregnancy. Toxemia is basically blood poisoning by the toxins from a local bacterial infection. Let us move on to the next short answer, which is the axillary nerve. The topics that will be covered under axillary nerve are its root value, course and relation, branches and distribution, and its applied anatomy. To make you easily understand, I'll be discussing in detail about axillary nerve in a form of a diagram. Let us start with the root value. The root value of axillary nerve is the ventral rami of C5 and C6. The peculiarities of axillary nerve is that the posterior division of the axillary nerve bears the pseudoganglion. The axillary nerve is an ideal example of Hilton's law. So what does Hilton's law states? It states that the nerve supplying the muscles acting on a joint supplies the joint and the skin over the joint. Let us move on to its course and relation. It arises from the posterior cord of the brachial plexus. The posterior cord lies posterior to the second part of the axillary artery. The axillary nerve lies posterior to the third part of the axillary artery. In the axilla, it lies on the lateral side of the radial nerve. In the quadrangular space, it divides into anterior and the posterior division. In the anterior division, it is accompanied by the posterior circumflex humeral artery, and it runs deep to the deltoid muscle and supplies the deltoid and the skin over its anterior part of the deltoid muscle. The posterior division supplies the teres minor, which bears the pseudoganglion, and it supplies the posterior part of the deltoid muscle. It pierces the deep fascia to become the upper lateral cutaneous nerve of the arm. Let us move on to its branches and distribution. The muscular part of the branch is that the deltoid from both the sides and the teres minor from the posterior division. The cutaneous part is the upper lateral cutaneous nerve of the arm, arises from the posterior division of the axillary artery and supplies skin over the posterior. And then it's the border of the deltoid and the upper part of the long head of the triceps. The articular branch of the shoulder joint arises from the trunk of the axillary nerve, and the vascular branch of the posterior circumflex humeral artery arises from the anterior division. Let us move on to its applied anatomy. The damage of the axillary nerve is caused by the inferior dislocation of the shoulder joint, and the damage of the axillary nerve results into the loss of the roundness of the shoulder, loss of abduction of the shoulder joint, and the loss of sensation of the skin over the lower half of the deltoid. As we have discussed everything in detail about axillary nerve in a form of a diagram, now let me summarize the most important points to be remembered. First is its root value, which is the ventral rami of C5 and C6, and next is its peculiarities. The posterior division of axillary nerve bears the pseudoganglion, and the axillary nerve is the ideal example of Hilton's law. So what does Hilton's law mean? It states that the nerve supplying the muscles acting on the joint supplies the joint and the skin over the joint. Let us move on to its course and relation. Remember that it arises from the posterior cord of the brachial plexus, and in the axilla, it lies on the lateral side of the radial nerve. In the quadrangular space, it divides into anterior and the posterior division. In the anterior division, it is accompanied by the posterior circumflex humeral artery, which is a branch of the third part of the axillary artery, and it runs deep to the deltoid muscle and supplies deltoid and the skin over its anterior part of the deltoid muscle. To move on with its posterior division, it supplies the teres minor, which bears the pseudoganglion, which is its peculiarity, and it also supplies the posterior part of the deltoid muscle, and it pierces deep fascia to become the upper lateral cutaneous nerve of the arm. Now let us move on to its branches and distribution. Under branches and distribution, it is very important to remember the subdivision muscular and cutaneous. Under muscular, deltoid from both the direction, teres minor from the posterior division. Under cutaneous, upper lateral cutaneous nerve of the arm arises from the posterior division of the axillary artery and supplies the skin over the posterior, the border of the deltoid, and the upper part of the long head of the triceps. The articular branch to the shoulder joint arises from the trunk of the axillary nerve, and the vascular branch to the posterior circumflex humeral artery arises from the anterior division. Let us move on to its applied anatomy. The damage to the axillary nerve is caused by the inferior dislocation of the shoulder joint, and the damage to the axillary nerve results into the loss of roundness of the shoulder, loss of abduction of the shoulder joint, and the loss of sensation of the skin over the lower half of the deltoid. Now let us move on to Flexor Retinaculum. Under Flexor Retinaculum, we will be studying in detail about its introduction, gross anatomy, relation, and its importance. As we have discussed in detail about Flexor Retinaculum in a form of a diagram, I will be summarizing the most important topics to be remembered under Flexor Retinaculum. To start with its introduction, it is a strong fibrous band of deep fascia connecting the proximal and the distal carpal bones of medial and lateral side. To move on with its gross anatomy, Its proximal medial attachment is to the pisiform bone and distal medial attachment to the hook of the hamate. And its proximal lateral attachment is to the tubercle of scaphoid and distal lateral attachment is to the medial lip of the groove of the trapezium. Its proximal termination is to the antebrachial fascia and distal termination is to the palmar aponeurosis and the palmar fascia. Let us move on to its relations. Under relation, we will be discussing in detail about tendon, arteries, nerve, synovial sheath and the bursae. The superficial tendon is the palmaris longus and the deep tendon are the flexor digitorum superficialis, which is 4 in number, flexor digitorum profundus, which is 4 in number, flexor pollicis longus, which is 1, and flexor carpi radialis. Under arteries, the superficial artery is the ulnar artery and the superficial palmar branch of the radial artery, and there is no deep artery found. The superficial nerve is the ulnar nerve, palmar cutaneous branch of the ulnar nerve, palmar cutaneous branch of the median nerve, and the deep nerve is the median nerve. There is no superficial synovial sheath, and the deep synovial sheath is for the flexor tendons. There is no superficial bursa, and the deep bursa is the radial bursa and the ulnar bursa. Let us move on to the importance of the flexor retinaculum. It gives origin to thenar and the hypothenar muscles. The tendon of palmaris longus is fused in the midline. It keeps all the flexor tendons in position and it converts bony gutter into tunnel. Let us move on to anastomosis around the elbow joint. Now, let us move on to anastomosis around the elbow joint. To give a very brief introduction, it is an important communication between the brachial and the terminal branches of the brachial artery, which is the radial and the ulnar arteries. Let us move on to its distribution. It supplies the ligaments and bones of the elbow region, the elbow joint and the superior radio-ulnar joint. To move on with the division, in the front of the lateral epicondyle of the humerus, the radial collateral artery branch of the profunda brachial anastomosis with the radial recurrent branch of the radial artery. Behind the lateral epicondyle of the humerus, the posterior descending branch of the profunda brachial artery anastomosis with the interosseous recurrent branch of the posterior interosseous artery. In front of the medial epicondyle of the humerus, the inferior ulnar collateral branch of the brachial artery anastomosis with the anterior ulnar recurrent branch of the ulnar artery. Behind the medial epicondyle of the humerus, the superior ulnar collateral branch of the brachial artery anastomosis with the posterior ulnar recurrent branch of the ulnar artery. Just above the olecranon fossa, a branch of the posterior descending of the profundi brachial artery anastomosis with the branch of the inferior ulnar collateral artery. As we have discussed everything in detail about anastomosis around the elbow joint, now I will be summarizing the most important points to be remembered. Let us start with its introduction. It is an important communication between the brachial and the terminal branches of the brachial artery, which are the radial and the ulnar artery. It supplies the ligaments and the bones of the elbow region, elbow joint and the superior radio-ulnar joint. Let us move on to its division. Under division, it is very important to know the front of the lateral epicondyle of the humerus, behind the lateral epicondyle of the humerus, the front of the medial epicondyle and behind of the medial epicondyle of the humerus, and just above the olecranon fossa. Let us discuss the important points to be remembered under the front of the lateral epicondyle of the humerus. The radial collateral artery branch of the profunda brachial anastomosis with the radial recurrent branch of the radial artery. Behind the lateral epicondyle of the humerus, the posterior descending branch of the profunda brachial artery anastomosis with the interosseous recurrent branch of the posterior interosseous artery. In front of the medial epicondyle of the humerus, the inferior ulnar collateral branch of the brachial artery anastomosis with the anterior ulnar recurrent branch of the ulnar artery. Behind the medial epicondyle of the humerus, the superior ulnar collateral branch of the brachial artery anastomosis with the posterior ulnar recurrent branch of the ulnar artery. Just above the olecranon fossa, a branch from the posterior descending branch of the profunda brachial artery anastomosis with the branch from the inferior ulnar collateral artery. To upgrade and enrich your medicine in the fingertips and to also get updated with the shortcuts and techniques